So hello and welcome to Conversations with Disability Rights North Carolina. I'm Tori Ekstrand. I'm an associate professor in the UNC Hussman School of Journalism and Media, and I'm happy to be joined today by Iris Green. She is a supervising attorney of DRNC's Disaster, Displacement, and Disability Project. And in that role, Iris and her team work to assist people with disabilities affected by, most recently, Hurricane Florence. And what they do, right, is to work and overcome the barriers, some of the access to funding, and secure much needed services for people with disabilities in the state. The COVID-19 pandemic has changed a lot about disability and disability advocacy in North Carolina. And today we're going to focus on some of the unique issues people with disabilities are facing, particularly those who have just been through Hurricane Florence, and learn a little bit more about the work Iris and her colleagues are doing to currently help. So Iris, thanks so much for doing this. We're happy to have you here.
Well, thank you, Tori. Yes, I am Iris Green, and I have been working with the Protection and Advocacy System since June of 2005. And I'm also part of the leadership for our disaster recovery team at Disability Rights North Carolina. So along with me, the disaster recovery team is staffed with two people, and they are community leaders who are based in Eastern North Carolina. They're Curtis Hill and Andy Anderson. And all of our disaster work is supervised by our director, who is Cass Sharon. Our disaster recovery team, we were born out of our agency monitoring shelters during Hurricane Florence. And so it was September of 2018, 7 of our staff members, we went in and we monitored shelters during that time. We monitored actually 26 shelters in 47 days. And during that time, we were able to speak in person with more than 300 people who had evacuated and they were displaced. We also spoke with some of the staff members who were working in the shelters as well. And the conditions that we witnessed during that time included inaccessible shelters, the lack of access to important programs and services and supports. And we also saw that there was a need for trauma-informed care. So if you recall, Hurricane Florence was a very long recovery process for people, and they stayed in shelters for a very long time. And so what we saw was that a lot of the staff members that were in the shelters, they were experiencing compassion fatigue, and they were running out of patience for some of the people that were sheltering there. And so these and the other issues we identified are in a report we actually published in February 2019. And that report is called the Storm After the Storm Report. And it was through that report where we were able to gain funding. A lot of people saw the report, and they were actually funded us to continue to do the work in Eastern North Carolina because they knew it was going to be a long recovery for a lot of people. And so what we do at the Disaster Recovery Team, we advocate for the civil legal rights of people with disabilities to help them remove barriers that have been preventing them from recovering. And we also identify resources to assist people with disabilities to recover. Our team is a little different from the other teams at Disability Rights North Carolina in that we are funded through grants, and most of our programs at Disability Rights North Carolina are funded through federal programs, but we are grant funded. And so the work that we do is based on the deliverables that we've agreed to provide within those grants. And so I guess if it's okay, maybe a good time to kind of talk about some of the grants that the people that have actually funded some of our work.
Yeah, I mean, I think it'd be great to hear more about who's interested in this work, and then hear a little bit about sort of what you have seen change as a result of those funders and the work you're doing with them.
Okay, and yeah, and a lot of the work that we're doing has not changed much. I think we're still we have a robust list of deliverables that we've agreed to do, and so. let's talk about some of the funders. The first funder was Port Light Strategies, the Partnership for Inclusive Disaster Strategies. They were the first group of people to give us funding to be able to do the work. They were interested in the recovery of people with disabilities after Hurricane Florence. And so they gave us our first grant. And with that funding, what we did, we held a disaster, displacement, and disability community forum in March of 2019. And this
That
was
was
located.
that was amazing, Iris. I just have to say I went to that and
Uh-huh. Okay.
it was incredible. I mean, it
Uh-huh.
was obviously heartbreaking, but it was
Mhm.
also very real and raw, and it really opened my eyes to just what had happened to people
Mhm.
down east.
Right. Yeah.
So that was an incredible event.
Right. And so we thought, the state was actually, recovering, and there were a lot of forums that were going on, but there was not a disability focused forum. And so we did that forum to focus specifically on the experience of people with disabilities during and after Hurricane Florence. And so we thought that gave us a lot of information about how we needed to move forward with continuing to work in Eastern North Carolina. We also received money from Operation USA. They are a Los Angeles-based international disaster relief and development agency, and they gave us a pot of money to continue to work in Eastern North Carolina after they read the Storm After the Storm report. We also received funding from the Center for Disaster Philanthropy to provide funding to help people respond to help communities respond to disasters. And we also received a grant from American Red Cross, and I think many people know who the American Red Cross are. And then the last grant came from the North Carolina Community Foundation. And through those grants, what we have been able to do is to try to employ a holistic trauma-informed approach to our work, which means that we're trying to meet people where they are, and trying to understand that families, they can rebound with resilience and in a sustained manner only when all of their issues are addressed. I think at Disability Rights North Carolina, we've been working on systemic legal issues, but with the disaster recovery work, it's important that we address all of their issues because we're trying to get them to be resilient and trying to get them to sustain the outcomes that we have actually provided for them.
Yeah,
And
can you talk a little bit, Iris, about, I don't know, I imagine you've and your team have talked to a number of individuals and families, right, that were affected by Hurricane Florence. Can you share a story or tell us a little bit about like what you have seen, what stories you have heard people tell you about the struggles they have had? It's hard enough to go through a hurricane. What is it like to go through a hurricane of that magnitude if you have a disability?
now, most of our what we've learned is that disasters, somehow they often strike in areas that are with vulnerable populations,
Mhm.
and usually these are flood zone areas. Somehow it seems that people with disabilities and poor people, they're often relegated to these areas that are hit by a lot of disasters. And more often than not, we have a lot of people that are still recovering from Hurricane Matthew,
Right.
as well as recurring from Hurricane Florence. And then, last year was Hurricane Dorian. So we have, some people that have been hit 3 times in the past 5 years with these different hurricanes. And so what we've been doing is trying to, in addition to trying to help them overcome the disability related barriers to recovery, we are working on a lot of issues. Like some of them have criminal backgrounds. And so you have a criminal background, it's hard for you to secure housing or trying to get back on your feet. And so what we've done, we've secured certificate of release for people who have criminal background records. We have written letters of reasonable accommodations and requests for modifications to make sure that they secure accessible housing.
Mhm.
We have most recently we have actually started qualifying a lot of our clients with homestead exemptions. We've learned that some of them who are property owners, they have property taxes that they haven't paid in years because they don't know what to do. They don't know how to continue after these big hurricanes that have hit. And so we've been trying to qualify them for homestead exceptions to get property tax relief to get their property taxes lowered. Um, We also identify and secure and advocate for affordable, accessible housing. Before Hurricane Matthew and Hurricane Florence hit, our state was in dire need of affordable, accessible housing. That was one of the biggest deficits in our states. And so you can imagine after Hurricane Florence, what the housing stock looked like now. And so just trying to make sure that when North Carolina build back, that they build back stronger and make sure they build back housing that's affordable. And so we've been advocating for those types of things. We also secure Section 8 vouchers for a lot of people because those vouchers are portable, which means that if they have to move around, they can take the vouchers with them. And we also try to connect our clients to a lot of resources, like the long-term recovery groups. They're the people that come in after FEMA leaves to make sure that the communities get back on track and make sure that people get back into their houses and reach some sort of stability. And so we've been working with those groups to advocate for our clients to get the resources that they're needing. We also help out with FEMA. They have funding as well as USDA and the community block development grants that come through the state. We've been trying to help our clients fill out applications and make sure that they get in line to be able to receive those fundings that are coming through the state.
Yeah, that's a heck of a lot of work.
Yeah, it is.
That is a lot of work. I mean, not that the
Yeah.
other divisions don't work, but because they've got plenty on their plate, but it is both a combination of legal service, but also really human service here.
Right,
Trying,
exactly. A
trying
lot
to,
of social work. Yeah, we've become
yeah.
social engineers in trying to help people recover.
And it takes a while after a hurricane hits. I
It
mean,
does. It really does. It's unbelievable. I think one of the success stories is a family of three people that was in Robinson County, and I think I'm saying it right. Yeah, I think they call it Robinson. I sometimes I say Robinson, but I think it's Robinson County. And this was a family that had left the shelter. They were living in their car, going from motel to motel, and all three of the family members had disabilities. And so we were able to, even during COVID-19, we just identified this family and was able to get them into housing that was safe. And one of the family members was a well, actually 17 years old, a young man that was told by the school, he had an IEP that if you drop out, then you don't have to go back. And of course, school was frustrating for him. And so he did, of course, he dropped out, but we were in the process of reconnecting him back to school because he has a disability and he can receive services until he turns age 21. And that would be a lot of resources for the family if he were to go back to school and continue his education. So we've been helping with families like that. A lot of our family, all of our family has a member who has a disability and is trying to overcome some type of barrier.
yeah, yeah. How has, so we've been sheltering in place now for over 2 months. How has the work changed? How do you approach this work when when the team itself is working out of homes? How do you do this work from afar?
Right, and I think the biggest barrier has been trying to meet with our clients in person and trying to advocate for them in person. The work itself has not changed, but how we do the work has changed. And so we're having a lot of virtual meetings. We're still having to make phone calls on behalf of our clients to make sure that their recovery is still on track. The other part of our work, some of our deliverables has been to try to prepare people for the future disaster. Like, we're about to approach hurricane season. And so trying to make sure that people are ready for the hurricane season. And so what we've been doing with that is we have been charged with conducting community disaster preparedness trainings to community groups in Eastern North Carolina. And so we have identified host champions whose role is to engage and convene a group of people within their community for our disaster preparedness trainings. And we had our first training, which was held in Bladen County. And we're working with the additional county. We have 9 more counties that we have to reach and do these trainings. And so we're having to do those virtually. And one of the problems that we've been finding when we tried to host our second one virtually was connectivity. A lot of people in rural North Carolina, they don't have the connectivity. And so we're trying to do trainings and trying to make sure that they get the hotspots and get the connectivity they're needing so that we can continue our disaster preparedness training in Eastern North Carolina. Um, with the past training that we've done, we have been able to implement, and this was the brainchild of Andy Anderson. He's one of the advocates that's out in Eastern North Carolina. He's developed a Neighbor for Neighbor initiative, and what this Neighbor for Neighbor initiative is that he's asked each one of the host champions and the community leaders that he's identified to reach out to four neighbors with disabilities and do well checks for people and identify the needs that they may have. And what they do, we meet every other Tuesday, and they bring that information back to the team, and then we're able to identify the needs and try to make sure that we meet those needs for the people that do have needs in the community. And so that has been a wonderful asset, and that has been a way for us to stay connected to people during COVID-19. We've also, before in December of last year, what we've done, we initiated or launched a leadership academy. And with the Leadership Academy, we've identified 9 community leaders to act as key contributors to continuing recovery efforts and future developments of disaster plans at the local and state levels. And then, our work right now is grant funded. And so if for some reason we're not able to continue to work because our fund has ended, these are the people that we're going to look to stay connected with us and to bring us issues and to continue the advocacy work in their communities if we had to cease the work that we're doing at Disability Rights North Carolina. And so we plan to stay connected with the community leaders that we've identified, and we are hoping that we will build trust and build that relationship so that if any legal issues that we do in our target work in Disability Rights North Carolina, we will be able to assist them with that, and then we'll be able to provide hopefully limited information and referral and get them the information that they're needing and help them to become the community leaders if we were to leave from doing this work.
It strikes me, I mean, it's extraordinary you're building this, network of people. I mean, these people have been there clearly, and many of them probably already leaders in their communities, but you're building this sort of connected network of people now for, what is likely, I would think, to stand forward or to carry forward through whatever hurricanes and disasters we have in the future. I mean, it is sort of a model
Mm-hmm.
for, for the reality of climate change, I think.
Right.
And
Mm-hmm.
I think that is, that just strikes me as really extraordinary. I imagine there are probably other states watching what you are doing, other organizations watching what you're doing, because this strikes me as pretty different and new.
Yeah, and we've been working with a lot of our partners to try to get information of how we stay relevant, how we remain relevant, how we keep people prepared, and so just working with leaders at the national level as well as some of our local leaders. How do we do this, and how do we? Because we know disasters are going to continue to come, and we want people to be prepared, and we want people to have what they're needing to be able to get. To stay safe and to be able to recover and become more resilient even after the disaster that they face. What we've also done is we try to put as much information out there and make sure that people understand what their rights are.
Mhm.
And so what we share with the Leadership Academy and the community when we do our community outreaches, we have developed fact sheets and brochures that talk about disability specific facts. We've developed brochures about the rights of people in shelters. What are your rights when you're in a shelter? What are you entitled to? We've developed fact sheets about the ADA, the Stafford Act, service animals, Section 504, and all of the other disaster-related civil rights tools that we use during a disaster. And so
Mhm.
we're making sure that people understand what their rights are and understand what the legal obligations are, and make sure that they understand that even during a disaster or pandemic, that these civil rights laws are not waived, and that they still have to be enforced, especially for people with disabilities.
Right. Absolutely. What concerns you looking forward to hurricane season, obviously, and now, of course, we have the additional constraints of this pandemic. Um, what's going through your mind as we approach fall here, and as you continue, you and your team continue to do this work? What are the concerns or the things that you're thinking ahead about?
I think the biggest thing is shelter. If we were to, we are in the middle of pandemic where we are right now orders to practice social distancing, but at the same time, how do you do that if you're hit with a disaster? And in the past, what we've done, we've used these congregate shelters in the past to be able to shelter people, and that's going to look different. And so, trying to the thing that's on my mind right now is, will North Carolina have enough of the non-congregate shelters available to be able to meet the needs of people that may need shelter after the disaster? And so we're discussing this at the North Carolina Emergency Management Center. We're part of the several work groups at the North Carolina Emergency Management to be able to address those issues. We have actually identified 3 work groups that are working on these issues. And the first work group is the agency organization readiness. And so what we're doing is trying to make sure that organizations are ready and prepared to continue the work if we are hit with a disaster in the midst of COVID-19. We've also developed a FAST work group, which is the Functional Assessment Service Team. And this work group it has identified and trained deployable team members to assist shelter workers with assessment of people with access and functional needs and other disabilities, and helping to ensure that the needs are met during their sheltering experience. And so we're excited about having that up and running. And in place. I think right now we have a little over 20 some people that have been trained that will be able to assist and making sure that the shelters remain accessible and make sure that people with disabilities have what they are needing as they move forward. And then the last work group that we're part of is the Shelter Accessibility Work Group. And this is the work group that is responsible for trying to identify and assess shelters for future disasters. And this is the work group that will be out looking for non-congregate shelters to make sure that we are able to shelter people. I'm pretty sure they'll have the congregate shelters, but most people probably would have to go into these non-congregate shelters, and trying to make sure that we have enough shelters in place to be able to do that.
Right. So I imagine these shelters are going to be similar to what we've had in the past, but different in the sense that you can't have as many people.
Right,
Um,
exactly.
yeah.
And then you may have people that may need their own space. And I know that right now during COVID-19, FEMA is reimbursing um, providers for non-congregate sheltering. So there are some providers that are providing sheltering for people that are living in hotels, but in these separate non-congregate
Mhm.
sheltering spaces. And
Yeah.
so that has been
Right.
good. So we're happy that FEMA did fund that for the homeless population, for people who are victims of domestic violence, as well as people who are being released from prison that may not have a place to go. And so
Right.
we're thankful that we were able to get the non-congregate sheltering approved for FEMA to reimburse people for providing that type of sheltering for
Okay.
people.
Yeah. So how can ordinary, regular North Carolina citizens be helpful in this effort? What can the rest of us do to support the work that you and your group are doing, and the work of these other organizations and then the funders here?
Um, the one thing that we have started, that was another one of our deliverable, is that we have started, we have partnered with the North Carolina Pro Bono Resource Center, the Partnership for Disaster um, it's the Portlight Strategies, the North Carolina Pro Bono Resource Center, and the National Association of Social Workers. And we are spearheading the very first North Carolina Disability and Disaster Hotline that is scheduled to launch on June 1st. We have a training that is scheduled on May 30th. And what we're doing, we're looking for volunteers to be able to man that hotline just in case a disaster strike this year. And so we're looking for lawyers, paralegals, social workers, students, and law students to help us man the very first North Carolina Disability and Disaster Hotline. And our first training, like I said, is going to be on May 30th, and it's going to be from 9 o'clock to noon. And so if you and even advocates can volunteer to be able to help us with that. But we do have the registration available on our website, which is www.disabilityrightsnc.org. You can go there and people can register, and that would be a great way to help us out with this work that we're doing in Eastern North Carolina.
That's fantastic. That's really great. Again, this unique combination of both sort of legal skill, right, but also this kind of on the ground assistance that so many citizens need who've been affected by disaster and now are, or may be constrained also by the pandemic. So Iris, thank you so much for doing this today. Thanks so much to you and your team for the work you do. It's just super important and becoming more important all the time.
Okay, and thank you, Tori.